I am Dr. G.R. Vastrad. Gurulingayya Vastrad is a long form. Usually nobody refers here. I feel somewhere I am not same person if this total name is taken. I am known as G.R. Vastrad everywhere. So let me be simple, because from the place where I come, names are not important for us. Family name is important. My Vastrad is my family name. Everybody in my family having Vastrad. Initials are there. Sometimes initials may be common. For example, another brother is there, Gurulingayya. He's G, myself G, but behind me there is DR. That is why I am different. So this is about my name. I am BSM graduate from Hubli Ayurveda Mahavidyalaya. After completion of BSM, I went to Jamnagar to do my PG in Kaya Chikitsa. After going there only, I felt the greatness of Ayurveda. As a student of undergraduate, though I was a good reader, best by hearted all slokas of many sahitas as a part of challenge between the competition between the friends, but never tried to understand them. Just by hearted, wrote them, got good marks. After going to Jamnagar, after listening to my teachers' classes, I felt I am an ignorant idiot. I don't know anything about Ayurveda. I wrote a letter to my principal. Sir, I am a first rank holder of our university. Unfortunately, I don't know what Ayurveda these people are talking. That was the difference of teaching there. So this was my experience. Then, after seeing my teachers, I decided to be a teacher. From that, of course, when I was a child, then only I wanted to be a teacher, but in between, I wanted to be a doctor, almost settled to establish modern medicine clinic OPD. When I was supposed to join PG, those days PG was not a big problem. Yeah, nowadays, a lot of competitions are there. There's only only few people used to go for PG. Usually, if anybody wants to do PG, then usually people laugh at him. Why he already wasted 6 years by studying this degree course. Another 3 years, why are you wasting? Go and work somewhere. That was the attitude then. So I went there. After seeing my teachers there, I felt the necessity of knowledge. And one more important thing, there the teachers interpreting this particular Ayurveda in a different way, different scientific level. That fascinated me. So because of that, I started studying modern science. Till that time, for us, BSM course is purely Shuddha Ayurveda. There was no modern subject. As now you have BMS, 50% modern, 50% Ayurveda. We were not having those things. Purely modern subject, Ayurvedic subject. We did not to read any modern books first. Though we used to read out of our curiosity, out of interest, but it was not a subject for examination. It was only for our knowledge. So there, we were from South India, weak in English, because in our days, local language was the language of teaching, and Hindi was not so strong with us. So we had to improve the English language. So that is one of my friend here in Andhra, Krishnaya was my classmate. So he made one program, seminar programs in hostel. Every Sunday we used to sit for 2 hours in a room where we should speak only English, no other languages. And one more thing, we selected one particular book, that is Physiology of Chatterjee, Human Physiology of Chatterjee. This book we should read. These are the pages we have to read for next seminar. So everybody should read them, read those pages, and they have to present it without seeing the books. This exercise made us to identify what are our weaknesses, where are we are lacking. So gradually, after reading Ayurvedic modern physiology, I understood the Ayurveda. Till that time, Ayurveda was totally mysterious subject for us. Then I understood the greatness of this Ayurveda. So from that day, I wanted to study Ayurveda always in the scientific aspect of it. So with that mentality, that background, today Vasti is the day. Today's day is the Vasti day. So I want to tell you what is the science behind this Vasti. We are giving Vastis. Many times, Panchakarma, basically I want to tell you, I was a teacher for Panchakarma for many years. I have defined Panchakarma as Panchakarma is a science of healing process of the Swasthya Rakshana. Both it is curating and also healing using the body's physiology. If you know the modern physiology, then you will understand the mechanism of Panchakarma procedures, how they act. If you know the mechanism of Panchakarma procedures, then you will apply it systematically. For example, a simple example, like probably Snehapana, that you have already heard about it. When you will do Snehapana for Shodhananga, because there are three types of Shodhananga Snehapana, Shamananga Snehapana, and Brahmananga Snehapana, right? When you give Snehapana for Shodhananga, when you give Snehapana for Shamana purpose, when you give Snehapana for Brahmana purpose. Is there any conditions? Our classics are perfectly recorded everything. I feel Ayurveda is the most advanced science of those days. Of course, not even today. If you compare today's science also, I feel it is most advanced. I feel many times I feel it. Right? What is it? I think I heard already. It is yesterday discussed about Snehapana. Is it? Of course, otherwise I will discuss it another day if it is not, because when Snehapana itself a big chapter. Now, today as Vasti day is there, so I want to limit myself to the Vasti day. You know, we will not talk about Uttara Vasti. There are a lot of questions in Panchakarma. One thing, Panchakarma, what are the Panchakarmas? What? Vamana, Rechana, Vasti, Charakad version. Charakad version is different. Originality is Charaka. Charaka is the original Panchakarma. Right? Susuta is not original. He borrowed this knowledge and he added his own thing because he had confusion. Vasti, Uttara Vasti, Niru Vasti, both are Vasti, then why it is to be two? So he had that question mark. I find many questions, many doubts by Susuta raised on Charaka Samhita. Accordingly, he modified his presentations. Right? So, Uttara Vasti, Niru and Anavasa both are Vastis. Then why two things are? It is Vasti only. So he wanted to add his one concept, one process of Raktamokshana as a fifth Panchakarma. But it is not actually fifth Panchakarma. Panchakarma is that thing only eliminate the dosha niskramana kriya, not the dhatu niskramana kriya. Panchakarma is never advises to remove any dhatus from the body. So as in Raktamokshana, Rakta is removed. It is not concentrating on doshas. Of course, doshas may be going out along with Rakta, because the Asayasi Sambandha, Pitta may be going there, Vata may be going out. So these things may be going out. But that is why Dhatu Shodhana was not the concept of Charaka. That is why he has not included Rakta Moksha in spite of knowing it. He knows Rakta Moksha. There is a reference of Rakta Moksha in Charaka Samhita, but he has not included it in it. That is why Panchakarma, don't think it's just Shodhana. It is both Shodhana and also Swasthya Rakshana. Total Ayurveda concept, Swasthya Rakshanam, Atasi Vishal, everything is achieved by Panchakarma only. That is why Panchakarma is one of the best treatment advice. Now we are coming to the Vasti. We have two types of Vastis. Right? Niru Vasti, Anuvasana Vasti. In Niru Vasti we use Snehas. In Anuvasana Vasti we use Kashayas, right? Different type of chemicals are there. As you know, the preparation, Kalpana, Vasti Kalpana, in that Makshika is there, Lavana is there, Thaila is there, Kalka is there, Kashaya is there. What total chemical? One more thing I want to tell you, our body is a chemical compound. And any change in our chemistry, that is a disease. To correct this imbalance in the chemicals, we have to give chemicals again. That chemical being modern chemical, otherwise Ayurvedic chemical. Ayurveda is, don't think it is different than medicine, different than chemicals. It is chemical only. Only we have understood them in a different for rasa, vipaka, etc. They are all again specific chemicals only. So this is the approach of Ayurveda is to science itself. Right? Now, when you look at this particular combination of Niru Vasti Kalpana, it is a hypertonic solution. lot of hypertension solution is. Whereas Sneha Basti is just Sneha, it is for. So Anuvasana Basti is given for Balanartha, whereas Neuro Basti is given for Neuronartha. Right? While giving that particular karmas, the Basti numbers are the 8 Bastis, 16, 15 or 16 Bastis or 30 Bastis. Anuvasana is given first, then Neuro is given, otherwise followed. Right? Why Anuvasana is to be given first? Why Neuro is not given first? This is the way we have to put question to ourselves. While reading our books, whenever we feel something is confusing, then put question there, write that question, keep it in front of you, then search the book, then you will have answer. This is the way of studying Ayurveda. Morning only two students told about the problem in understanding Ayurveda is because it is in Sanskrit. Of course, in those days, Sanskrit was the medium of those days. They have written in those days, they have not written for today. So our compulsion is we have to learn Sanskrit. It is not a big problem. I too never known Sanskrit before coming to Ayurvedic course. Never seen a Sanskrit word itself. After coming to the Ayurvedic college, when it made me compulsory to read Sanskrit, I started studying Sanskrit. Particularly, I started studying Vyakarana. Sanskrit Vyakarana is most important. Don't read any other thing, but know the Vyakarana first. After reading Sanskrit Vyakarana only, I understood the Vyakarana of other languages. In Kannada Vyakarana, I was not knowing at all during the whole school days. After reading Sanskrit knowledge, Sanskrit Vyakarana, I understood the Vyakarana. So this is the beauty of Sanskrit. Then whenever you are reading, don't read just translated material. Read original slokas. Try to understand them. Do the Shabda Vivechana. If you have problem, then you come to the Hindi translation or Telugu translation or any other language, English translation. But most of the times, I find problem in translations. Translations are wrong. Many times I have found, particularly in English books, the English Charaka translated book, I find many confusing words. They use the word particular word may not be suitably correct to that particular sloka, particular word. So that is why always better to read original Sanskrita, though it may be difficult in the beginning, but as you go on practicing it, after some days it becomes easy for you. And once you read Sanskrit, and then you will enjoy reading it. Particularly Chakrapani Samhita, Chakrapani Tika, if you start reading it, then you will enjoy Charaka Samhita. That is the beauty of it. Always, all commentaries you should be able to read. So that is why you have to know the Sanskrit better. Then only it is helpful to you. Right? So as I am coming, this Vasti Kalpana is a hypertonic solution. This Snehana Kalpana is, and one more reference I want to take you, bring to your attention is Bhava Prakasha. In Bhava Prakasha, as most of the time, Vasti is Vataharanam. Morning only you heard about it. Vasti is Vataharanam. But as per Bhava Prakasha, Vasti is Niro Vasti is Vata Pragopaka. Niro Vasti is Vata Pragopaka. You hear from the Bhava Prakasha. Right? Then the question again, what is Vata? Basic question. What is Vata? What is Vata? What is that one? What is the meaning of that one? Sloka reciting is a very easy job for us. But actually, what is that Vata? If you read unfortunately, the modern readers of Ayurveda have confused what is Vata. The gas, whatever is formed inside, moving here and there, entering, coming out, that is called as Vata. Because suitably the words are there. One of my examiners, in final PG, I had a patient of cardiac problem. I presented the case to the examiner. Then after taking my examination, he was explaining to my classmates there. There was a Vata, Malabhadata was there. Because of that, there was Avrodha to the Apana Vata. Apana Vata ने समान मत को धक्का दिया, समान वात ने प्राण वात को व्यान वात को धक्का दिया, इसलिए विद्रोह हो गया. This was the version. We do find such type of Vata as a air in many modern Ayurvedic books written by modern, particularly Western Ayurvedic doctors. I have read it many times. Whenever I reading these things, I just feel very sorry for not reading oral text in the oral context. According to Charaka, Vata is not a Murta. Vata is a Amurta. Right? Amurto Murta Karmasya. In Charaka Sahita it is mentioned that. Whereas the same thing, when it came to the Vagbhata's level, Avyakto Vakta Karmasya. In the minds of Vagbhata at that time, I feel Vata is already air. Air, the concept of air for Vata has been already in the minds of Vagbhata. That is why Avyakto Vakta Karmasya. He has used. Why he has not used Amurto Murta Karmasya? Both are not same. Murta is a matter. Murta is a matter. Vata is not a matter. Vata is not a matter. Right? Vata is energy. Right? Vata is energy. And we are because of that energy. If you read the Vata Kalakali Adhyaya, 12th chapter, Sutasthana, wherein he in detail explains what is Vata. And there he says that, Punarusatra says that, I will try to explain you what is Vata. I am not sure, I will explain you. So in this way, Vata is energy that is working in our body, and channelizing that energy is possible by Vasti. That is what is called as Vasti Vatarana. And what is that channelization? Probably you know in the rainy season there will be lightning. That is again energy. That energy goes to the earth in the form of lightning. It gets somewhere dispersed. Energy cannot be stored, cannot be generated. So that energy has to be transformed for normalcy. Vata should be asammata gatihi. Vata should be asammata gati as per that particular Sutasthana version. Vata should never stop. If the Vata stops, then there sanchaya, then such energy storing. For example, if you keep regulator, nowadays you don't find regulators, in the regulator, old style regulator, fan regulator, if you keep that regulator on 5, keep the fan on for 1 month, regulator will never used to get warm. But if you kept that particular regulator at 1, keep it for 3-4 hours warm, regulator used to get warm. So in this way, if the Vata is restricted in its movement, because basic character of Vata is Chalatva, if Chalatva is restricted, then that causes conversation in some form of energy, in some other energy form. So that energy form may be in the form of some sort of chemicals, which stimulate certain chemicals, and these chemicals in turn again stimulate some other things. In this is some chemical activities going on there. So in the same way, in our body, so many hormones are there which are representing Vata. Representing Vata. Right? In this, one more statement, if you look at the modern physiology, particularly Gattin physiology, he says, our gut is second brain. Our gut is second brain. Morning Murti has told that Vata, main center is Udaram. It is fact. Ayurveda physiology is very perfect. And gut is our gut is second brain. So anything happens here, it has effect on our brain. For example, we use, at the end of the lunch meal, we use curds and rice. It is a more scientific, because by taking it, our brain gets some sort of stimulation, some sort of relaxation. That is why in our food style, that has been part of regular item of food. So this energy, as in particular area, as I told you, all over the body, this Vata is disturbed. And at the same time, because of that Vata Vruddhi, so many chemicals are disturbed. And these chemicals are stored in the intestine area. Right? So by giving Vasti, Minu Vasti, these chemicals are taken away. Why these are taken away? Because the fluid, whatever you put there in the form of around 500 or up to 1000 nowadays we put. So Dwadasha Prasthuta, that is, of course, today we are not practicing. The amount of quantity, whatever is given there, it causes holomic pressure. Right? Holomic pressure stimulates the brain to evacuate. And second thing, it is isotonic solution, hypertonic solution. It absorbs the fluid from the intestine. So as it absorbs the fluid, chemicals mix with those fluids which are harmful to our body, which are representing the water, energy format. Those chemicals are brought into the intestinal lumen and they are pushed out. So in this way, the energy which was unnecessarily stored in the body, that energy is diverted. Otherwise, that is, as we have an earthing mechanism to our houses, good big buildings, in the same way, Vasti is nothing but an earthing of water from our body. So that is why this is given. Whereas second anuvasana is that one which is actually repairing. As Bhavaprakash told, it is a vata karaka because these chemicals, whatever we use in the anuvasana Vasti, Niru Vasti, are causing irritation to the bowel. Causing irritation to the bowel membrane. So this irritation is to be minimized. That is why first anuvasana is given. Second, nirvana is given. So again, as we cause some irritation, so we have to again pacify it by giving anuvasana. So in this way, for a specific number of days, we give niruha. Then depending on the number of the days of niruha, we follow anuvasana. Sometimes it may be 3, last 2 or 5 or 7 like that. We just end up with the treatment. So in this way, what this anuvasana and niruha are, one, the anuvasana is actually healing the irritation caused by the nirvasti, and whereas niruha is actually irritating the intestinal mucosa, draws the chemicals present in the intestinal walls along with the chemicals which are representing the water, and those are removed. And now one question I want to ask you here, for Virechana or Vamana, we follow Snehana, Svedana. Whereas why not this for Vata, Shodana, we don't follow Snehana, Svedana? Of course, local Abhyanga is done, but we are not doing Snehapana, Sarvadika Abhyanga for Vasti karmas. Why? Because chemicals are present all over the body. Those chemicals cannot be brought in the way as Snehapana, and for Snehapana, there is this for Virechana and Vamana, there are specific centers in the brain known as pollutive center, vomiting centers. The total preparation of the patient for Snehana, for Vamana and Virechana is aimed to stimulate the purgation center and vomiting center. So these centers stimulated and the particular action is instantaneously for once, otherwise for a particular, for one program it happens. But whereas we cannot do this type of thing for Vasti, in spite of having a water and having a Snehana is the best medicine, but we don't do Snehapana, and Snehapana is contraindicated. Snehapana is contraindicated for whenever you do Vasti, you should not do Snehapana. This is one aspect why this particular, what is the mechanism of the chemical action of these anuvasana and niruha in Vasti karmas. Right? Now, I want to tell you about the mechanisms, how they are. We are having a protocol, SOP, standard operating procedures in the form of Purva karma, Paschat karma, Pradhana karma, and Paschat karma. What is the Purva karma of anuvasana? One more thing I want to tell you, as per the physiology, our large intestine, if you draw a midline in the body, left part of the large intestine is secretory in nature. Whereas right part of the large intestine is absorptive in nature. Exactly midline. No, left is secretory and right is absorptive. Now look at the Purva karma of anuvasana Vasti, Purva karma of niruha Vasti. What we do? Just you do Abhyanga and Svedana. Then if you, after giving anuvasana niruha, you follow certain Paschat karmas. In niruha Vasti, patient is made to lie on the left lateral portion, Vasti is given, and patient may be asked to go out to evacuate it. Because it comes out, because you have created a pressure there. And again, additionally, there is the release of the chemicals, because the medicine you put there is in this particular left part of the large intestine. Left part of the large intestine, and that in large quantity. So it absorbs fluid, sends signals to the brain. There is a peristaltic movement and expulsion of the Basti. So that is why it is expected to have Basti Pratyagamana before 45 minutes, within 45 minutes. If it is retains there, then action will be different. Chemicals will be drawn back into the system. These chemicals may cause some damage somewhere because these are the Vatakaraka chemicals. These are Saindava, this Madhu, Vatakaraka, right? Kashaya, whatever is given is Vatakaraka. These Vatakaraka chemicals goes and cause Vata Buddhi, so that may cause Vata Prakopa again. So that is why this Nirobhakti should not be allowed to stay for more than 45 hours. If it is not coming, then it is advised to keep Vartis. By using Varti, you have to see that it is coming out. So if you don't do it, then if it doesn't come, then whereas you are not supposed to expect the immediate Pratyagamana Anuvasana Bastis. It has to reach the right part of the large intestine. So what are the Paschat Karmas of Anuvasana Bastis? Patient is on left lateral position. Basti Dravya is kept there. Then patient is ought to be on supine position. The attender is supposed to lift by holding the leg toe, he has to lift the leg up to this, so that the Basti Dravya should enter into the sigmoid column from rectum, because the drug we kept in rectum. Whereas this Nirobhasti is getting into the sigmoid column directly because the quantity and force we are using. Here just for small quantity is there, it just gets into the rectum, then it has to get into the sigmoid column. That is why we just lift it to send it in rectum properly. Then after sending it, then patient is not to lie on left lateral portion for some time. Right? And he is supposed to be there on bed. It is advised, if it is by Anuvasana Basti, better to give it on the patient's bed, not on Panchakarma theatre, because after giving Anuvasana Basti, patient should lie in the bed. So, and after that giving, what you will do? You will do massage. This anti-clockwise massage you are supposed to do. So all these things, what the Panchakarma, this Anuvasana Basti, Paschatkarma procedures are there, they are supposed to see that ile is coming into the right part of the large intestine, so that it is going there. Then it is observed by body, because that is thyla is there. Along with thyla, it has so many nutritive chemicals, and these chemicals are having healing activity. So whatever the inflammation caused by the Anuvasana Basti will be caused by the next day in the Anuvasana Basti, that is prevented. And if it is caused next day following the Anuvasana Basti, are going to prevent this. So in this way, the body's physiology has been understood by our acharyas properly. Then accordingly, they have planned the Panchakarma procedures. So Panchakarma is a perfect scientific approach. If you know the science in it, then you will not do any mistake in application of it. If you don't know the science in it, if you wrongly apply it, then you may come across some problems. Just I will give you 2 examples of my experience. To one of my patients, I advised my PG student to do this Vamanakarma. I advised him to do Vamanakarma. Usually I never used to go to the Panchakarma that is so early at 5 o'clock. It was the duty of that boy to collect the chavi from the attendant to prepare for the Vamanakarma procedures. Unfortunately, he forgot to collect the chavi. Patient was prepared properly. At 5 o'clock, that's 6 o'clock, he ranks me, sir, chavi, unfortunately, I have missed taking the chavi. I have not taken the chavi, so I don't know where the attender's house is there. Then I said, what I should do now? If you have done a mistake, then what I can do at this case? You have to do something. Then somehow he tried here and there. It was 7 o'clock. At that time, he got the address of the particular attender, got the chavi. He did Vamanakarma after 7 o'clock. Then at 9 o'clock, he told me again, sir, patient, I have given Vamanakarma at 7 o'clock. Patient is complaining of abdominal pain. Then what I should do? Then I asked him to just give this medicine. If there is any problem, then shift her to some nursing home there. Then, of course, patient was not referred to the nursing home by the medicines given. Patient was already, the medicines are listed in the books. What medicines are there? Out of the list only I have given. So Just timing is most important in Panchakarma procedures, as discussed earlier in the earlier presentation. Basti, Uttara Basti Sahib. There is a Vat dosha, Vata kala should be given. For example, many times, though our hospital is known for Panchakarma, I used to say to my students, we are only 30% correct, 70% we are wrong in Panchakarma procedures. Whatever the classical procedures, in that we are 70% wrong. Patient, our students used to say, sir, how do we say like that? So book says like this, but we are doing like this. Because we have compromised with the Panchakarma. There is no compromise. The science is perfect. Only thing we should understand what it says. For example, Snehapana for Shodhanartha should be done before 7 o'clock. 6:30 to 7 o'clock. In that time only, you have to give Shodhananga Snehapana. The food taken in the early night should be digested. Patient should not have appetite. Patient should be on empty stomach. And the medicine to be given in Uttam Matra. 7, maximum 7:30. If you give after 7:30, it's not going to be Shodhananga Snehapana. It can be Shamananga. Instead of Shamana, Shodhana, you are doing Shamana, which is not advisable. It's not advisable. For example, for Shodhanartha, the objective of Shodhanartha, this is Vidyam. What is that slogan? Vidyam, Vishandanat, Pakat, Margasya Shodhanat, and Vayosya Nigrahat. These are the five objectives of Shodhana. Because preparation it is. So for Vriddhi, we give Snehana. Because of Snehana, there is a Vishandata. Then we do Shodhana, Swedana, there is a Pakata. Then because of Snehana, Shodhana, all these things, there is a Sokamako Vishodhana. Right? Dosha comes from Shakata Koshta. Then after doing it, we do Vatasya Niyamana. What is that Vatasya Niyamana? What do we do? What is the direction of the Abhyanga for Shodhanartha? Anlomana, should be Anlomana. Because if you look at the modern, otherwise old Chinese or Japanese concept of energy, chi energy, there are many meridians. There are meridians, different meridians are there. And if you just look at meridians, Sayatu books are there, Sayatu meridians are there. Different lines are there in the body representing the different parts of the body centers. Numbers are given. This number represents the particular thing in the body, like the photos are available. And if the Abhyangas, 7 portions are divided for this Shodhananga Snehapana. If you look at the 7 portions, exactly on the lines, meridian lines, these fingers are falling. I have tried it. I have seen it. I have exhibited, I have demonstrated to the students how the meridians are actually followed. Without knowing the idea, without having the idea of meridians in our textbooks, but meridians are adopted and followed while doing Abhyanga. So that is whatever the procedures are there, for example, 7 portions of Abhyanga, they have to be meticulously, honestly, sincerely to be followed for the Vatasya Niyamana. If you don't do it, just you apply, just application of oil, up and down, then Svedana for some time, you will not get proper Shodhana. You will not get the proper number, proper Shodhana, Lingi collection, etc. Whatever I have explained, you will not get it. So that is for the best Panchakarma benefits, understand the science in it and follow it. This is the one thing. And as the today Vasti program is there, I want to tell about Siro Vasti also. Uttara Basti, everything is covered. Siro Basti, why should not leave Siro Basti? There are other Bastis also. First, let me talk on Siro Bastis. Out of Chaturveda Sneha, Mastiska Chikisas, Sirodhara, Abhyanga, Shirobhyanga, Pichu, Dhara, Basti. In order, they are explained. Right. So, but before that, I just want to talk. I don't have any much explanation necessary to talk about Abhyanga and Pichu. They have their indications as per the Susut Sahita. They have indications listed there. You can refer them. But this particular Dhara, how it works? Just we put Dhara. I just wanted to know how this works. One of my students, the principal of Kalavirasva College, Dr. Kirillagowda, Once he came to my college while doing PG. His work was on Sirodhara. He did Sirodhara on 500 cases with Takadara. Takadara 500 cases on hypertension. Then I advised him to do Dara with Jala. I questioned him whether it is a Takra effect or Dara effect. He had a question mark. So how you say, if it is Takra effect, why you waste here? Put it inside. If Takra is a chemical that is working there, then let it be inside. Why you unnecessarily put it on head? It's not active. If you drink Takra, it's not going to reduce the blood pressure. I advised him, do one thing. Instead of Takra, use Ushna Jala. Jala, which is not having any medicinal value, Jala. Let us confirm whether it is the effect of Dara or effect of Dravya. He tried it. Then he told me, sir, it is not the effect of Takra, it is the effect of Dravya. Then why you are wasting Dravya? Why you are wasting money of the patient? Use Takra, the Jala. Of course, we do not deny that particular medicine has certain its own effect, but still, as Shastra has said that it must have something. We have to prove it. We have to prove it chemically by research studies. What is the role of Takra in this particular while doing Sirodhara? Then I said, better you look at the procedure, what is to be adopted. At the same time, one of my students, his classmate, who was working at the Thames Valley University in London, he rang me. Sir, you told about everything about Panchakarma, how Amanakarma works, how Virechana was, all the mechanisms you explained, but you never explained about Sirodhara. Because I have to speak on this, one of the international conferences, I have to speak after B.M. Hegde. So, it's a big challenge to me, sir. That is why just you have to help me. I said, till this day I don't know what is the mechanism of Sirodhara. That is why I have not. As a teacher, I tell only that thing what I know. I don't tell anything which I do not know, unless why to complicate myself. So that is why I never told. But now you have to tell me, sir, because your student is at the risk of insult now. So you have to prepare article and send it to me. Then I have to work on that. Then I sent message in the college to discuss on Sirodhara. I just put that word, one worm of Sirodhara in everybody's mind. Everybody, including students, were discussing on Sirodhara. One day, one of my colleagues said, why everybody is discussing on Sirodhara in the college? I have made that atmosphere because I want some answers from somebody. Then one day, Murthy sir came. You read Sahasradhara, Sastra Yoga book. In that there is a discussion on Sirodhara. One solution I got. Somebody told me about Guyton physiology. Till that day I never referred it except Chatterjee physiology. As I am fond of Charakas, in the same way I am fond of Chatterjee only. So I read Chatterjee physiology. Then after reading some other books, I came to know one mechanism that is governing the Sirodhara. Then I came to know about the limbic system. That limbic system is having connection by the trigeminal nerves. Fifth nerve, trigeminal nerves. From here, it goes in three branches. Finally, it touches the pons. And from pons, limbic system rises and it communicates with different centers of the brain. Please go to the modern physiology, particularly Guyton physiology. Read the limbic system. Just look wherever the Sirodhara is recommended in either textbook. Same thing is there or not. Anidra, etc., etc. They have mentioned it. Just read it. Read comparatively. Then you will understand the value of Ayurvedic textbooks. Then I prepared the article. I sent it by email. Then the warrior who was in charge of that particular university got this article, then saw this and he took a copy of that. So in this way, on that particular incidence of that particular student, I got the idea about the physiology of the otherwise mechanism of the Sirodhara. Then still there is one more important Vasti karma, Sirobasti. I was not having answer. Then I went on thinking the mechanism of Vasti. because the procedures, whatever has been explained in classes, we have to keep them in mind. The height of the Vasti is 12 angula. Siro Vasti Charmapata should be 12 angula. Why that should be 12 angula? This is the question I put myself. Then aisle is supposed to be just Kesha Parenta. Aisle height should be that much. And aisle should be warm. Aisle warm, actually, here the quantity of the volume of the aisle, the temperature, they start to be maintained. If there is any alteration in the quantity of the temperature and vibration in this volume of the aisle, then the effect will be different. While you keep that particular Sirodhara with a particular volume, particular quantity, or particular time, as classic explained, there will be secretions through the nasa. There will be watering in the nasa. Eyes will be watering. So as these things are watering, in the same way, there will be in the brain also there will be secretions. So many chemicals are secreting in the brain. So after seeing this particular comparison between the Sirodhara and Sirovasti, I developed a concept that Dhara is to be given if you want to stimulate the brain. If you want to stimulate the brain, you have to use Dhara. If you want to rejuvenate the brain, then you have to use Vasti. That is why we changed the concept of this Mastic Chikitsa in the cerebral disorders. If the patient is to be stimulated, then we used to go for Sirodhara. For example, after so many days of disease, patient's brain almost non-repairably regretted, otherwise degenerated, otherwise not repairable. In that stage, if our attempt is to just to stimulate regenerate the cells, we have to give Sirobastics. By that, there is a possibility of rejuvenation of these some dead brain cells which can come into action. So whereas Vasti is a later treatment when everything is lost, this is the last resort. But when there is chance of recovery, that time better go for Sirodhara. One more thing in Sirodhara, the height of the Dhara, from what height it should fall. After that we did a lot of work on that. What should be the height? What should be the thickness of the Dhara? There should be a Kanishthangoli of that individuals, not a standard cap system. And temperature to be always maintained standardly, which is tolerable to the patient. There is no standard degrees, no degrees mentioned. It is all comfortable to the patient. What is the comfortable to that time? That temperature. So the volume, that volume in the vessel. If you look at the Sahasra Yoga book, they have given the size of the volume. What should be the size of the volume? What should be the shape of the size of the patra and shape of the patra? And I just concentrate on these things. Why this is size, particular shape has been recommended. Keeping these size, shape, etc., and the amount of oil that to be kept in the patra at a constant level, so that volume allows the particular pressure there, and temperature stimulates, and movement you create, rhythmic movement, left right movement, stimulate the trigeminal cells in this area, and that in this internet stimulate the limbic system. So there is here in Dhara, volume, pressure, temperature, and continuity for a particular timing. Time is most important. If you miss anything, for example, in our hospital, this used to happen. We had only 2 attenders. There used to be many number of patients, and usually our attender used to put oil and ask the patient to make these movements. The patient used to do this. Patient has to make the movement, and he has to do Abhyanga somewhere. Some Katibasti is there, Janavasti is there. He has to do all these patients. When he has to come back to our patient, this particular Sirodhara patient, oil is totally empty in the patra. This type of treatment, though we are doing Sirodhara, but it's not going to help the patient. That is why these things to be kept in mind: the volume, pressure, temperature, rhythmic movement, and timing. The particular time, 45 minutes, minimum 45 minutes. Otherwise, some people are following gradual increase of timing, gradual fall of time. That also okay. But these are most important. If we miss these things, in spite of application of the particular Panchakarma therapy, success will not be as expected. So that is why Panchakarma is a perfect science wherein mechanics works. So you should know the mechanism of all these procedures. Without knowing the mechanisms, just following the practice, whatever is going on, that is not going to help the patient, and it's a waste of time, your time, patient time, and money. This is the science I am just looking out of this Vasti. Today we are just limited to Vasti, so that my talk is just on Vasti. And any questions I expect, because it is I am not habituated to talk to the students, just respond to the students' questions. Last 10 years of my service, I never gone to the classroom with any topic. Today also I not came here with any topic. They called me, I came here. The topic was not planned. As Vasti was going on, Murthy said, you talk 50 sentences on Vasti. So that is why I am here. Right? So I used to go to the class, then I used to ask them, are there any questions, any doubt on anything? Because syllabus copy is with you, books are there. You can read books. You can read and understand better than me. So don't ask me to talk on syllabus points. Just put questions, whatever you have coming across while reading, put those questions. Then on those questions we will start discussions. So it was my plan here. Well, I just talked to the Dr. Perumal. Ask the students to have some questions. Today morning also, ask the Murthy sir to have questions from students. We are not bothered from which college you are there, what is your name. It will not be in our mind. But if you put a question, you are in our mind. That question is in our mind for lifelong. So we want to identify you people by your questions. So as you are here for another 5 days, I expect questions. If you just go and whenever you make a note of question, put those questions. You writing of the questions, then we will discuss those questions. That may help you better than what you are listening to us. So any questions, just anybody having, make them note of those questions, transfer those questions to us. So we will answer them. We will have a sitting for that. We will question answer sitting, because Ayurveda is basically not on teacher explanation system. It is a question based answer system. So let us follow that particular Ayurvedic approach by question and answer. So I expect from tomorrow there will be some questions. You talk to whatever the questions related to the particular topic presented is different thing. But any questions concerned with the Ayurveda, any questions concerned with your practice, any question concerned to the future, your future in Ayurveda, just talk to us. So let us see what are solutions we can get. Because the aim of this particular workshop, as I was told by Perumalji, to make our Ayurvedic doctors to practice Ayurveda. I know as a practitioner, I know 90% of graduates are not practicing Ayurveda. 95% of Ayurvedic graduates are not practicing Ayurveda. All these questions are there. As today morning, Dr. Murthy said about the one director, he put me one question, so why your doctors are not practicing Ayurveda? I said, sir, in our colleges, there are no hospitals. Hospitals are there only for the purpose of inspections. On the day of inspection, everything is ready. But after inspection, nothing will be there. And second thing is, our practitioners, after completing graduation, they have to go to the rural areas, as well as small urban areas. They have to practice. The general practice level complaints are Jara, Kasam, Swasam, Shulam, etc. These are some common problem in day-to-day practice they come across. For these things in our college, there is no training. As long as our students are not getting experience of the handling of Jara, how we will handle the Jara in his private practice. So this is the basic problem with us. Then what we should do? We should, now I suggest him, we should have a Jara clinics. We should have respiratory problem clinics so that we have to attract patients on that. And we can manage Jara. Not only that, we can manage emergencies. I've taken a project to speak on emergencies management, because emergency is not just medicine, it's a management. We too have emergency managing drugs. On that day, my experience in emergency handling, I will discuss with you. But we do have good medicines for Jara. For example, morning only Dr. Murthy mentioned about the Godanti. One in Maharashtra, Godanti Misana is available. Of course, it's available nowadays everywhere. It was the formula of Maharashtra practitioners. Godanti, Amrutsattva, and one more is, just it is out of mind now. This I tell you other day. This Godanti Amrutsattva, one more is something I just missed. 3 combinations. I have used it in these even tribal patients. Just because I'm sharing my experience, because we too never exposed to the journal. In undergraduate college level, there was a system of practice, OPD system, 3-chit system was there. This small 3 chits, different formula, different chemicals are mixed, chits are formed, 3 chits are given to the patient, and that patient has to go to his house with 3 chits. Next day he has to come, and anything for small jara, kasa, all those things, the treatment was given. Purely Ayurvedic drug combinations. And next day he used to come to us, and his jara is little less. So we used to have confidence, yes, this is working. So in that way, in those days, every small practitioner, general practitioner used to handle every such common elements of the common people. But now Ayurveda is a consultant system of practice. Small diseases are not handled by us. Even for cough, we don't have effective medicines. For jara, medicines are there. But unfortunately, we are not having exposure to those medicines. We don't know how these medicines are working. We don't know what medicine to be selected. If I want to tell you, if you want to know from me, there are thousands medicines for fever, 1,000 formulas for fever. If time permits, if opportunity is there, I will talk the beauty of our formulations. It's not that simple just to you have to go and pick up any medicine given. Every patient requires a particular medicine. We have to give specific medicine. Just example, when I was working in the Taranath College at the beginning, my seniors used to give Google Kalpas. In those days, Google Kalpas were available in the government. Tripura Google they used to write to some patient, sir, that Google is not there. Then give this Google. That is not there. Then give this Google. My seniors would, then if this Google can be alternatively given, then what is the necessity of so many Gugulus by Ayurveda? One Google would have been sufficient. Then I went home, opened a Baisa Sahita, then compiled all the Gugulus, ingredients, put them in a chart, then indications, those indications I put them in a chart. Then I found that these formulations are not that simple as they appear to be. There is science in it. As I observed, for every formula, some drugs are common, some drugs are specific. Just when I compared one Google to other Google, some are common, something is special. Then, as I took that specialty to the next indicated conditions, it is indicated a particular water. Let us take the Ama water. Again, along with Ama water, there are so many diseases. Then I understood that this drug is just more suitable in Amavata Adhikara. The drug is mentioned in Adhikara, Amavata Adhikara, Rakta Pitta Adhikara, etc. These type of descriptions are there. And that drug is to be given only in that disease along with other complaints. Usually what you, while reading Shastra, you will be more confused. One drug is recommended for, one formula has a number of ingredients. And that drug is recommended for number of disease. We don't know where to use it. We cannot use it in all the conditions. And if you use it, you don't get results. You have to use it in a specific condition where the drug is being recommended basically in this. For every formula, there is adhikara. In that adhikara, this drug is to be used. And along with that formula, what are the other indications are there? The patient having that particular disorder, having these symptoms, in them, this drug is good. Whereas other patient, other drug is given. So just I give one example. I was sitting with my one friend in one clinic. He got a patient of hernia, of course, operated hernia, having severe pain. He got operated in the Bijapur district. He was working in a police department, Bangalore, and he consulted many doctors in Bangalore. His pain was not subsided. He was about to go to the doctor who operated him to complain and find a solution for that. Before that, he came to my friend, and then my friend referred it to me. Vastrad, do something to it. Then I gave him Tripla Ugulu. I was just out of the college then, not having much idea about the clinical practice. I gave him Tripla Ugulu blindly without knowing why I am giving it. Then, after some days, one more patient came with sciatica. Then he reported, I gave Mahavatu Dosasana. Both patients got well. Then he asked me, because he was my senior, was knowing Ayurveda, when you are teaching, you used to say the pain is because of Vata. Both are Vata, because both are having pain, both are Vata. But for this complaint, he gave this drug. For this complaint, he gave this drug. Why? I said, I don't know. I don't know why I gave it. I gave it. That's all. But drugs responded. After coming to the college, when I started teaching, then I started analyzing the things. Then I came to know that this Tripla Ugulu is useful because of the inflammatory condition caused by the operation. There it is Rakta and Vata is involved. So that is why it works there. Vata Pitta is not, that is work. Whereas this is purely neurological disorder. So Mahavatu Dosasana work there. So after studying the drugs, then I understood this drug is useful here, this drug is useful. In this way, every drug is having their own indications. So you must study the drug. So that is why I will give you an idea how you have to analyze the drugs. Don't take things randomly. If you go randomly, then probably specific treatment is not possible. Right? With these words, I just conclude here because some other day we will discuss about drugs.
Any doubts on the answer? Any questions regarding Vasti?
Matra Vasti, right? Matra Vasti is one type of Sneha Vastis, right? So it is so simple because it is to be given for repairing for bala, to develop strength in the body, for any repairing or for develop balyartha, this is given. So that is why, as is given balyartha, there is no restrictions of samaya, conditions, etc. So the small dose is given. So in a time it can be given. So it will be observed because all these snehas are to be observed. But the only thing, what I just, Anavasana Vasti is to be given on empty stomach. Niro Vasti is to be given on empty stomach. Anavasana Vasti should be given after food when the hands are ardra. At that time only you have to give it. If it is delayed, then mechanism is different. Sometimes my hospital, you go up, they used to do Abhyanga Sweda, etc., local Abhyanga Sweda, etc. Then ask them to go to the hotel, have the breakfast, then come. Then he used to go to hotel having breakfast leisurely, then having smoke, etc. Then he used to come. Around half an hour time they used to spend there. After coming, Basti is given. And as Basti is given, immediately as when he comes out of the table, immediately Basti Pratyagamana happens. We should retain the Basti Pratyagamana. It is possible when the patient stomach is full. When the stomach is full, that time the peristaltic movements are slow. That is why I am telling you, read physiology, modern physiology. As long as you are not reading modern physiology, understanding of Ayurveda is incomplete. So when you have food in our stomach, our peristaltic movements are slow. When it is empty, then they are faster. So that is why for Nirobasti, patient should be an empty stomach. After giving something, if you give Nirobasti, Basti Pratyagamana will not happen.